Hi, I'm Ruth Hansten, and we're going to be talking now about Section 9, Evaluation of Results. So, wow, you have been through all 8 sections so far of the Professional Practice Specialist program. And so now we are just coming to the culmination of the program and to really begin to now take a step forward, evaluate the results, evaluate what you've learned, and to think about the progress that has been made from the beginning of the course to now. We'll talk a little bit today also about how you prepare for your testing and the different ways that you can test for the course. So, if you're with us, Section 9, Evaluation of Results, is in your portfolio, and depending on the version of the portfolio, it's probably page 51. In the evaluation of results, what we're asking you to do now is to get some feedback from the end of shift and to get that kind of celebration feedback checkpoint so that it's a debriefing, just as is used in the airline industry and other industries, so that you can find out how you want to use your critical thinking to move forward more effectively. We're going to talk about the 4 P's in prioritization. We would like you to read Chapter 5, that last chapter in the ROC Planning and Implementation Manual, which is Coaching, by Kimberly McNally. We also encourage you to read Kimberly's executive coaching manual that she wrote with Liz Cunningham. It's just tremendous. It came out in 2010, I believe. So if you want to get information on that, it's through Sigma Theta Tau. There's a self-assessment of listening skills that you can take, and there is a cost to take that. This is an online test. It's just if you would like to. We want you to think about your next steps, your growing edges, where you want to move forward in using these principles going forward in your practice. And then we want you to take your evaluation of the course, as well as the evaluation of how you think you or your department have moved forward throughout these months in improving their professional practice. So Worksheet 19 is the end of shift feedback form. And so we want you to use this form to help practice debriefing. And if you're in a particular job that this worksheet doesn't work for you in this version, please feel free to change it, just so that, you know, the idea here with this Worksheet 19 is to, at the end of an episode of care, or the end of a month or the week, to be able to actually say, how well did things go? What would work better? What was so successful and why? What recommendations would you give to each other in the team so that we can move forward more effectively with the next episode? So this is an opportunity for celebration, and honestly, we make a huge impact on the health of our community every day. So it is worthwhile to celebrate what happens. And even if it's a patient who dies with not very much pain and one of their family members there, that is something to celebrate, because we allowed that to happen. We navigated that patient through the system so that they could have that kind of a death. If it is the fact that the patient's pain level went from a 10 to a 4 in your shift, that's fantastic, especially if you're that patient laying there in the bed. So celebration is a huge, important part of us being able to return tomorrow and do the same work again with gusto and purpose. Worksheet 20 is prioritization and the 4 P's. And so we talk about prioritization here because as we complete the course, we'd like you to be able to think about how you prioritize the goals that you have going forward as you implement the practices of ROC. Worksheet 21 is My Growing Edges. This is kind of an opportunity for self-coaching. So that you could say, okay, you know, what challenged me this year? How has the ROC program changed me? What risks did I take? What were the results? How am I using my talents effectively? what innovative ideas do I have that are exciting for me, and what things are holding me back, so that I can then make some plans to help myself attain the goals that I want to achieve professionally. And so celebration is still a really important piece of this. Worksheet 22 talks about what you've done and evaluating your progress, and it asks you to go to the online course evaluation. This is a different URL than we took at the beginning of the course when you did your self-assessment. We are going to ask for your name on this so that we know that you've completed it. What we do with this information is that we compare the before and after of our courses. So we look at what were the professional practices at the beginning and what were the professional practices like at the end of the coursework, so we can do some comparison. We've found up to 37% improvement in the way people practice from the beginning of the course to the end of the course. Of course, this is self-evaluation, but this is the best way that we found to be able to do that. We also want to know your comments on the coursework. So we'd like you to think about evaluating the actual care that is happening also. And so on worksheet 23 is transfer evaluation. So if the person's being transferred from the ER to the surgical unit, or the ER to the ICU, or from the hospital to home health or skilled nursing, we'd like you to check this out with your boss first or your supervisor first, in case there are already people who are doing this kind of questioning and they have a set way they're doing it. We don't want patients to be called and families to be called more than once for the same episode of care. But we do want people to get some experience with finding out about the care that's being delivered in their specific area from the perspective of the client or patient. So however that might work for you, figure out how you can get some information. Some people that have specific people hired to do that job, and they don't want the people that are taking the coursework to actually call any patients. We do give you a little script in here for the transfer evaluation and worksheet 23 and worksheet 22. But in worksheet 24 for the discharge evaluation, we give you a script, but sometimes people have just aggregated the patient responses, the survey responses, to look at what kind of care is being delivered or what the perceptions are of those that are receiving it, so that they do get that kind of information. We found this has been really instructive and helpful for personnel to actually talk to patients after they've been admitted to find out how things went. So those are there for you as worksheets and as scripting for what you might say on the phone. We do have a certification checklist then that talks about your activity list. Remember, you had an activity list at the beginning of the portfolio that went through all the activities that you would want to do to complete the course. The next bullet point is your online testing, your storytelling. Your story comes to us, and your critical thinking problems. So those are the two things you send electronically to us. And then if you want to, remember, if you haven't already registered with Olympic College, if you want to get the course credit, the 4 credit hours for nursing at Olympic College, please let us know because that needs to be done as soon as possible. Also, some of your organizations have CE that they give in your organization. If you want to have independent study CE through your state association, nursing association or other association, there are independent study forms that you can usually download or call them and receive those. So make sure you've done that. And then you get ready for the checkoff. Now the checkoff is, we send you times that you can do an open portfolio conversation. We review all of the sections. It's over an hour-and-a-half period with colleagues that are in your organization or colleagues that join us from across the nation. You can also alternatively go online and you can do an online test, which is open book again, open portfolio. So if you want to do that, we will give you the URL for that when you're done with the test online, if you decide to take it that way, we check it off and then we let you know how you did. So those are the ways that you can get checked off, and those are the things that you do to complete the program. If you have any questions, please contact us at the Rock office, email us or call us, and we'll get back to you as soon as we can to help you complete the program. When you have completed all of the program, and when you've done all these steps, you will receive your certificate of completion as well as a really lovely rock pin that says specialist on it that you will be able to wear. We are very proud of being able to help you navigate through this material so that you can be that internal consultant in your own organization to help promote professional practice. Thank you so much for your efforts and for all you do for the patients in your community and the health of your community.